special meeting of the USD 305 Board of Education. Please stand and join me for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. We have our agenda before us. Is there a motion to approve the agenda?
Mr. President, I approve the agenda as printed. Emma Doherty.
A motion, Mark, second. All in favor, raise your right hand. Opposed, same sign. Motion carries 7-0. We will go to Ms. Exline for the USD 305 return to instruction.
Well, August is upon us, and I can't believe it's already July 27th. But districts all over the state and all over the country are making decisions about the return for the 2021-2022 school year. And as part of the return, all districts are required to have a district plan for the safe return to instruction and continuity of services. Our plan was required to be posted to the USD 305 website by June 22nd, and it was. At that time, we were following the guidance that you had given last year when we actually did our reopening plan. So that would have been last summer when you directed me to follow the medical guidance. And so when this plan was developed, that is what we were doing at the time. The guidance is rapidly changing, and in fact, the CDC issued another update just this afternoon. And so things are moving quickly, and as school is upon us, the next BOE meeting, the next regular BOE meeting is actually the day before school starts. It's important that we make decisions on a timeline that allows our families and our staff to be prepared for school, to make decisions about school, and for us to be ready for kids when they enter the buildings at the beginning of the year. Our principals are making plans for their in-service, and our teachers actually report next Friday. So it's amazing to me. It feels like just yesterday we were wishing the kids well for the summer, and it's time for students to come back. I need to be able to communicate expectations with our building leaders so that they can be prepared for staff. So at this time, we're mid-enrollment, and actually enrollment is happening right now. There's a flurry of activity over at Central High School, and that is going on until later this evening. Today was that walk-in enrollment piece, and then we have the online enrollment that's been happening for some time. As enrollment is progressing, like I said, that medical guidance is changing, and I'm needing direction. I'm needing direction from you collectively about how you want me to move forward. What I need is for us to review our district plan for that safe return to instruction, and for you to identify if there are any areas where you want to make adjustments. And then I also need guidance on how you want me to move forward as we move forward through the year, how you want decisions to be made at that time. Our goal, as always, is to provide the very best instruction that we can to students, to keep students in school, and to have continuity of the educational program. And so as you're thinking about what I share with you tonight, keep that in mind. We know the importance of a great teacher, and we know the importance of that face-to-face time with a teacher, and what we also know is that face-to-face instruction is critically important to student progress, academically, socially, and emotionally. So with that, I want to show you the plan, and I won't read the entire thing to you. This is posted to our website, and like I said, it has been since June 22nd. But I do want to go over some key points with you from the plan so that you can identify areas that we may want to discuss further, that you as a board want to discuss further. And then I also want to give some local and state context as well before we open for discussion and input from you. So the first thing that is required in this plan is a discussion of the universal and correct wearing of masks. At the time that this plan was written, we said that we would use CDC and KDHE recommendations to guide our decisions. Again, that was based upon the directive that I had from you last year to follow the medical guidance. And the controlling agency in the state of Kansas when it comes to the schools and infectious disease is KDHE. At that time, we said that masking was optional for vaccinated individuals and that it was strongly recommended for our children ages 3 through 11, and that individuals who are eligible for vaccination, meaning those that are 12 and older, including adults, but who are unvaccinated, were expected to mask in USD 305 facilities. We weren't going to require masking during physical activity, vigorous physical activity, because that recommendation came out of the American Academy of Pediatrics, that we not require masking when we are engaged in vigorous physical activity. Outdoors, masking would not be required, and that we would not be requiring verification of vaccination status. So that was the universal and correct wearing of masks. We also said that we would be posting information about correct masking and masking requirements in our buildings. The next piece that we had to address was how we were going to modify facilities for physical distancing. And what I want you to know is that our plan is, right now, is to provide as much space as possible between our students. We will use stable groups, and what we mean by that is that we will keep students seated with the same group of students in the classroom as much as possible. That way, if we do have someone that does happen to come down, unfortunately, positive, there would be fewer people that would be exposed. And that if desks are touching, we'll try to separate those desks as much as possible, trying to keep students, the pods of students 6 feet apart if we can, but as much as possible. Hand washing and respiratory etiquette. Of course, we will continue the hand sanitizing and respiratory etiquette. We've been teaching students about proper hand washing and respiratory etiquette, and we will have signage available. We will continue to have hand sanitizer available. That is something that I think had a really positive impact on other cold and flu last year. So that's probably something that will continue for years to come. Cleaning and maintaining healthy facilities, including improving ventilation. We are very fortunate in Salina that our community has supported our schools, and our ventilation meets or exceeds all recommendations. We will be regularly disinfecting frequently touched surfaces, just like we did last year. And we will be providing cleaning resources in offices and classrooms so that additional cleaning can be done. But that was a real focus last year, and we will continue to do that. Contact tracing, I do want you to know that we will continue to work with the Saline County Health Department. They are the authority agency in that circumstance. They are the agency that actually says that, yes, this person has to quarantine, or no, this person doesn't have to quarantine. So in the case of a positive case, we would work closely with Saline County Health to determine steps that we need to take. Let's see, diagnostic, testing and screening. What we were thinking at the time is that we would use our school newsletters to educate our staff and families that we really want them to know the symptoms of COVID-19, and that we would encourage them to screen their student and staff members to screen themselves prior to coming to school. We will have signs and reminders at our building entries. And we will not require COVID-19 testing, though. It is readily available in the community, and at this time, we were thinking that we would not require testing. You really can go and actually purchase a test right now, and there are different places around town that are offering testing as well. We would partner with Saline County Health and the other health agencies if there were opportunities for free testing that were community-wide to just get the word out. As far as efforts to provide vaccinations in our school communities, any vaccination clinic that would be part of a USD 305 event would be shared with our families. You may know that we just had 2 vaccination clinics. We did one for families that were interested at the field house during our summer lunch program, and we did another at Cottonwood for families that were interested during our summer school programming. We do have another vaccination clinic that is scheduled and of course those are in conjunction with Saline County Health, but that is scheduled for the back to school fair. And so that will be available to anybody who would like to get vaccinated, students that are eligible and adults in the family. Of course, we would share information about community vaccination clinics as well. We had to address appropriate accommodations for our students who have disabilities. And anytime we have a student that has individual needs, the IEP team meets. We think that the best group to make a decision about what an individual child needs is the adults that know the most about that student's learning needs. And as the student gets older, the student is at the table as well, but that those decisions are left to that IEP team. As far as coordination with state and local health officials, I talked about that a little bit above. I have been and will continue to meet consistently with the Saline County Health Officer, and our nursing staff does work very closely with them as well. They've been a wonderful support to us. On the instructional side, how we will address academic needs, our goal is to provide that high quality instruction every single day. And we will provide small group and individual support appropriate for student needs. That support varies by building depending on student need and staffing. We did allocate a significant amount of our ESSER dollars to hire additional staffing to provide some small group academic support for those students who needed some additional help. And so those dollars will be well spent in that way to provide support for students' academic needs. As far as social, emotional, and mental health needs, we are very fortunate. I think our teachers would tell you that we are very fortunate that we have counseling staff in all buildings, social workers in all buildings. We have nursing staff in all buildings. We do provide social emotional curriculum at elementary and middle school. That is a regular part of what we do. We will continue to do that. We will also encourage families and staff that if there is an individual need on the academic side or on the social emotional side, that we need to get together as the adults around that child and rally around that child for what supports are available and can best meet the needs. And then finally, health and food service. We will continue to provide breakfast and lunch. As you know, the USDA has said that we will be providing lunch for free, that it will be subsidized by the federal government at this point. And that we also will have our meals will meet the nutrition guidelines. And then finally, that, like I said earlier, we do have school nurses at each attendance center. That's been very helpful through that. That is helpful in a good year, but in a really challenging year when you're facing the challenges of a pandemic, that certainly is important. So with that, I want to go back and give some local context. I want to start with just where the community gating criteria is now. There are 3 characteristics that are reported, and this actually came from the county health website. And these numbers actually come from the Kansas Department of Health and Environment and then are combined and put on our local county health website. So you can see that the 2-week positive percent rate is in that top row. The positive percent is simply the number of positive tests compared to the total number of tests that are taken. We were looking really good this summer, and I was so incredibly hopeful. And things have gotten worse over time, but we are at a 12.21% positivity rate in Saline County when I pulled that data off the website today. As far as the 2-week cumulative county incidence rate, what this means is how many cases we have per 100,000. And we are now at 227 in Saline County per 100,000. And our local hospital capacity, this is something that is critical because we're green, that is a critical piece to watch because we want to make sure our hospital is at a point that if you or I have a car accident or a heart attack, some kind of medical emergency, that there is room in the ER and in the hospital for them to care for us. And so that's a place where we really do keep a close eye. So right now, that's green. As far as our summer programming, I want to share with you what happened in our summer programming as far as COVID cases, because this is, I gave you the city context, and now I want to give you our school district context. At elementary summer school, we had 740 students. We had 107 staff members, and we did have one positive COVID case. That COVID case did result in 49 families being contacted. At secondary summer school, we had 558 students and we had 52 staff members. We didn't have any COVID cases. Summer school ended last Friday. Summer conditioning, we had 516 athletes in and out of our buildings, 25 staff members that worked that intermittently. Those 25 people weren't there every day, but 0 COVID cases reported there. And finally, at Heartland, we had 89 children at Heartland. We have 100 staff. That would include the food service staff and the staff that is not directly in the classroom. And we had 1 COVID case there. So that is where we were as of last week. Now I want to transition to the CDC guidance. As I told you, KDHE is the regulatory agency in the state of Kansas, and what they have said and what the Kansas State Department of Education has said is that we should be following the CDC guidance. And so I just want to highlight a few things. I pulled these from the July 9th, 2021 guidance. Keep in mind there was new guidance issued today. What they are saying is that we need to be in person. Kids need to be in classrooms. That vaccination is the leading public health prevention strategy. That at this time, and this has changed, bullet number 3 has changed, they were saying that masks should be worn by all individuals who are not fully vaccinated. But today, the recommendation that came out is different from that. So I want to make sure that, that I point that out. And that we should maintain at least 3 feet of physical distance and combine that with indoor masking. So that 3 feet of physical distance, as I told you in our plan, we spoke to that in our plan, we will maintain as much distance as we can, and in most instances, we can get to that 3 feet. As far as the going on with that guidance, they are recommending many of the things that you heard in that plan, the screening, testing, the ventilation, hand washing and respiratory etiquette, staying home when you're sick, getting tested, and contact tracing. So all of those things that we spoke to in the plan. And then really encouraging students, staff, and students, teachers, and staff to stay home if they have any signs of infectious illness. And that's just good practice in any year. And then on that third bullet, I would just highlight that they really are emphasizing implementing layered strategies, which means that one strategy probably is not enough, that we really need to do multiple strategies. So that we really do need to be doing the respiratory etiquette and cleaning and masking if we decide to do that, and whatever the and is, but layered strategies. The updated guidance that came out today, and I have at about 2 o'clock, so this was kind of last minute here, is that everyone, students and adults in a K-12 setting, should mask regardless of vaccination status. That's what came out today. But they are continuing to strongly encourage the vaccine as a public health strategy. I want to turn to the American Academy of Pediatrics. And they released guidance on July 19th. Also new guidance since our last board meeting. And what they are saying is that students older than 2 years old and all school staff should wear face masks at school. And that the reasons are that there's a significant portion of our students who are not eligible for vaccination at this time, and that protection of unvaccinated students is critical. They're also talking about the low vaccination uptake within communities and continued concern for variants. So this is the American Academy of Pediatrics. They're also speaking to it's critically important to develop strategies that can be revised and adapted, that we have to be willing to make decisions and then adjust based upon what is happening in our schools and in our community, and that administrators should refine approaches when specific policies are not working. So they also spoke to that multi-pronged approach. Then they turn to monitoring attendance of all students. We do that just as part of our regular practice. We know that attendance has a huge impact on a student's ability to graduate and how important graduation is, and we know that it has a big impact on their ability to learn. And so having that consistent attendance is something that we are always attending to, and that we should communicate again with public health authorities. So you can see that many of the things that are in that return to instruction plan are in the guidance from CDC, and they're also the American Academy of Pediatrics also speaks to those same things. And that policy should be guided by supporting the overall health. Remember, we talked about academics, mental health, social, emotional. So I do want to turn now back to Salina. I have been in conversation with Jason Tiller, who is the Saline County Health Officer, and his organization is who determines what quarantines are required. And so I want you to know the way the quarantines will work, because I think that's important for you to consider. If both the infected person and the exposed person are masked, and they are at least 3 feet apart, quarantine would not be required. So I'm going to give you some examples. So if I have a student that is positive, and there are 3 other students that are within that 3 to 6 foot window, that's what we're talking about. If all of us are masked, and we have a positive student, the only student who would have to go home is the positive student, and that student would have to go home to isolate, okay? In masking scenario number 2, if we have a positive student that is not masked, and we have 3 other students that are all masked, all 4 students must go home. The positive student would go home to isolate. The 3 other students would go home to quarantine. Masking scenario number 3. If the positive student was masked, and 2 of the close contacts, meaning the students who are within 3 to 6 feet, were masked, and 1 was not, the positive student has to go home to isolate, and the 2 students who were wearing masks, because the positive student and those 2 students were wearing masks, they would not have to go home, but the unmasked student would have to go home to quarantine. Okay, so lots of layers here, but I want you to understand the impact on distancing on quarantines and masking on quarantines. So if I'm farther than 6 feet, I will not have to quarantine, but in that 3 to 6 foot window, that's where the masking matters. Okay? So with that, I want to turn back to that district plan for safe return to in-person instruction and continuity of services. And I want to remind you that, again, I need 2 things from you. I need to know, are there any areas that you want me to pull back up and that the board as a whole wants to discuss making changes? And then how do you want to make decisions moving forward? Because you'll remember the guidance says that we need to be prepared to adjust as we go this year. So with that, what questions do you have? And I'll just open up for discussion. I'll turn it back over to you, Mr. President, how you want to handle this from here.
Okay, so the first question, I guess, is areas of discussion from our board.
Could you go back 1 slide to those
Back
masking
1 slide.
scenarios?
Yes?
I might ask a question just on this for clarification. There were a couple terms, isolate, quarantine, are those different?
I apologize. Isolate is what they expect for the person that's actually positive. So you already know you're positive, you're supposed to isolate and stay away from other people. A quarantine is what they expect you to do while you're monitoring for symptoms at home. So they use the term isolate for the positive, quarantine for those that were exposed.
Okay.
Within that, in most instances, within that 6-foot bubble. In a school, there is an exception in the CDC guidance for that 3 to 6 foot window that is based upon mask, no mask.
And is there a time frame assigned differently?
They say
with each of-
10 minutes.
I'm sorry, on isolate versus quarantine.
They're both 10 days. I got that clarification today because I thought that one was 14 and one was 10, because at one time that was, but I asked for a clarification today, and both of those are 10 days.
Okay.
The 10 days of quarantine is actually from the date of exposure, and then they're supposed to monitor the last 4 days for that 14 days. The 10 days of isolation is from the date of onset of symptoms. So it's a little confusing when you're moving through this with families, and that's why we need the county health department to help us with all of those nuances.
Just to make sure I understand, this is from Saline County Health Department. So this applies not only, these things apply not only to schools, they apply throughout the county in every setting.
No, these, there is a caveat in the CDC guidance that allows in a school setting this masking exception. So in other environments, if you are within 6 feet for 10 or more minutes of a positive, you're going to be required to quarantine. Masked, not masked. That it doesn't matter in other environments. In a school environment, the CDC has said that, that this is acceptable.
And ultimately, Mr. Tiller's office will be relying on USD 305 staff to help. I mean, if we get a positive case, they're going to be relying on staff to monitor the 3 to 6 feet and all those things.
Yes, Mark. So what happens when there is a positive, the county health department, a lot of times the parent notifies us, or the staff member notifies us, because they want to protect everybody's safety. And so in most instances, we already know. But county health will notify us that there's a positive, and at that time, our school nurse will begin contact tracing. And so what they'll do is look at seating charts, who the child sit by at lunch, visit with the teacher for who was in that bubble, if you will. And then once they've identified those students, then the conversation happens with county health. Here are the students, and here's the situation with these students, and here's the situation with these students, and then the determination is made of who to quarantine. At that point, we notify families using our messaging system, because many times it's not just one or two. Many times there are multiple students, and so we notify using our messaging system that they need to quarantine. And we actually have a letter from county health, because they're the ones that are actually authorizing the quarantine. And then any questions are directed back to county health for clarification. Does that answer your question? Okay.
Very much, thank you. I have one other follow-up question as well. I appreciate everything from CDC and the county health department. Have you had contact yourself with any local medical people beyond the health department and have their thoughts in relation to it? Going back, just for me personally, I liked the original plan, but the increase of positive cases, the CDC guidance that came out today,
Right.
Those things have me rethinking, especially some of the mask requirement in my mind. But I want to think about Salina. I'm not necessarily concerned about the rest of the state and the world, although I am. And our job is to worry about USD 305 schools. And I'm curious what local practitioners think about that.
Right.
Pieces, if you know.
I have had personal conversations with 4 practitioners and received emails from 2 additional practitioners, all here in town, practicing physicians, pediatrician, pediatric neurologist, just all kind of different positions, and family practitioner, ER, and they are all saying that we should follow the guidance. That's what they are telling me, the CDC guidance.
Mr. President, would there be, like under masking scenario 2 here, would there be situations where either a masked student or staff member had to interact with a unmasked student or staff member and would put themselves in a position where they might have to quarantine later and not be face-to-face with a teacher in a classroom for a period of time?
I think with staff, absolutely, because our staff is charged with educating our students. And there are times where students need help, need someone right next to them, need someone showing them something in a book. So with staff, absolutely, teachers and other staff. With students, I think it would be highly unlikely that we would be able to keep the classroom separated like that. And I'll give you an example. In an elementary school classroom, there are times where we are doing very targeted instruction. And so during small group reading time, okay, we do a whole class reading time where we're reading grade level text. During small group reading time, we're reading text that is what I call just right. It's instructional level text. And so if there are 3 of you, if Dana and Gabe and Mark are all reading at the same level, you are at the table with me and we're reading instructional level text. That's where you make the maximum progress as students. Then you would go back to your seat and I would pull Ann and Jim and Scott if they're at the same level, and maybe Emma is also at that same level. They would be with me, we would be having that small group instruction. During that time, we do whisper reading, we do phonics work, so there is a lot of closeness during that time. There would definitely be 3 feet, but it definitely would not be able to be 6 feet and be able to have the other things that are happening in the elementary classroom happening at that time. So, short answer to your question, would we be able to absolutely separate those who were masked from unmasked? I just, as a former elementary school teacher, as a former high school principal, I don't see how.
Okay.
Are you sure? In these 3 scenarios, if the staff is vaccinated, does that change anything?
I have to think for a minute. If the staff member is vaccinated and the staff member were exposed, the staff member would be asked to monitor for symptoms, but would not be required to quarantine. Does that answer it? So
Yes.
that would be the difference. And in at the secondary, that would be the same thing. If there were students that were exposed, that had been vaccinated and they were on the list of you were a close contact and they were able to show proof of vaccination status, right now, the guidance is that they would not have to quarantine,
Right now?
right now.
Okay. Go ahead.
My question is, how flexible, I don't mean within the guidance, but if, for instance, our whole city got vaccinated and wore masks and the number of cases went way down, how soon would we be able to adjust these guidelines? Or our opening rules?
I think that is something that we would have to discuss and that would be a conversation that we would need to have with Saline County Health. At what point, if everything's in the green, that was where we were this summer, and it felt really different. It was liberating. It was wonderful for children, and it was wonderful for adults, and everything was in the green, and we weren't putting kids at risk. We weren't putting staff at risk. And so, I think that is certainly something that if the board decided that, okay, here at this threshold, we would like to change policies, we certainly can do that. And I know I'm not speaking in real specifics, Ann, but that's, I don't know where that threshold is.
But you continue to monitor the county statistics, and so if they looked much better, we could adjust.
Yeah, I actually, Monday, Wednesday, Friday at noon, the KDHE website is updated. The county releases the information every week. but I update my own dashboard every Monday, Wednesday, Friday at noon, just so that I kind of know where we are. I also collect where we are in terms of positives and quarantines so that I have a feel for what's happening in our buildings. The other thing that I'm looking at is, can we staff our classrooms? And last year, I have to tell you, it did get dicey at times. It was challenging to staff our classrooms, and Erin can speak to that. There were times where we were, going across buildings to do that, and, many times we're administrative staff and what we call specials staff, people that didn't have don't have a grade level classroom, or people that were on plan were stepping into sub. So we're monitoring all of those metrics all the time, just so that we can make sure that we're providing quality instruction to our students.
Thank you.
I just printed this off from the American Hospital Association this afternoon, and the Centers for Disease Control and Prevention today adjusted its guidance for fully vaccinated individuals, urging indoor masking for all, and in their including schools where all in attendance should wear masks. The CDC found that its data, in which 8 of the 10 sequence samples of the SARS-CoV-2 Delta variant, indicates that in rare cases, some vaccinated people infected with the Delta variant after vaccination may be contagious. And so the new science is very worrisome and unfortunately warrants an update to our recommendation. And of course, CDC continues to urge the American public to get vaccinated, but at this time, masks are probably going to be very vital. And as our mission statement says, we embrace challenges. Here we go. Thank you.
Dr. Bander?
Back to Ann's question about flexibility. You talked about enrollment earlier, and I'm curious kind of off the topic a little bit, how's things numbers for the virtual school looking? And my follow-up to that question is, if students are currently, as of today, registered for face-to-face instruction, but depending on whatever decision might come about, they'd like to change to virtual, can we allow that? I can't remember where we stand on.
Yes, we
Kind
can
of a
absolutely allow that prior to school. And so if we would have families that wanted to move from the comprehensive school to the virtual school, they could. Mrs. Rector, do you have updated numbers?
Yes, as of 3:30 today, we had 92 students who had virtual requests for 92 students.
So 92 for virtual requests.
Just to follow up, once school starts, I remember some piece about we wanted to prevent going back and forth all the time,
Right.
which I totally understand. But once school starts, if you're in virtual, you're in virtual. If you're not, you're not. Is that a reasonable statement?
Right. The students would need to stay in virtual or stay in the comprehensive school until semester. And then at that point, if we wanted to transition, am I speaking correctly? Okay. I should have deferred that one rather than answering and thinking, am I speaking correctly? So.
Ms. Exline, the biggest concern I see personally myself is related to the quarantining piece.
Okay.
Can you speak to last year, where we were with that, how that worked out?
I can.
That's where I see the biggest effect on our students, on our families, on our businesses, on our community.
Okay, so I pulled those numbers today, and last year, we had 281 students that tested positive, and that resulted in 2,027 quarantines. Keep in mind, 10 days each. Staff, we had 152 positives, resulting in 1,154 quarantines, 10 days each, for a total of 433 positives for 3,181 total quarantines. So that was between August 7th and June 4th. And I will be just very honest here. Sometimes we end up with a case that doesn't require any quarantines. And sometimes we end up with a case that requires many, many quarantines. It really depends on the individual situation, what the student is involved in, if the extracurriculars, bus rider. So there are a lot of caveats to that. So you can't just divide and say, because I did do the division, and it was between 7 and 8. Each one of the positives resulted in 7 to 8 quarantines. And then I thought, you know what, although that seems meaningful, I'm not sure it is because it really depends on when symptoms started, when the exposure occurred. So, but we did have 3,181 total quarantines last year.
On your quarantines list, I believe some of those were the same people being re-quarantined.
Yes.
Because I know I had a granddaughter that was quarantined several times, and I could understand why.
Yeah, we did have several classes that had several positives. And I'm thinking of one class in particular right now where we had a positive, students were quarantined, they came back for 1 or 2 days, had a positive, students were quarantined, they came back for a day, had a positive, students were quarantined, and it was 3 in a row. And at that time, if I remember right, the quarantines were 14 days because that was early in the year. So yes, that there were instances where there were multiple exposures and multiple quarantines for the same child. Those conversations are so hard to have with the parents because it starts to impact livelihood. And it's just, that's really difficult for families.
So if I may follow up on that and going back to the scenarios here, that's kind of the extreme example, obviously. Let's just hypothetically say that in that classroom, and given today's guidance from CDC and these things up here, let's say all the students were masked. Everybody that was masked would not have to quarantine?
That is correct if they were 3 feet apart. So if the board decides to go that way, what we would tell our staff is we really need to be keeping students 3 feet apart if at all possible. There are going to be circumstances where that can't happen, but that we would do everything we could to keep students that far apart, or we would do, if you go back to, this gets us into another area of that reopening, or we would be looking at the cohorting, the podding, so that if I have to be closer than 3 feet, I'm always with the same people to try to limit exposure. So that's how this kind of starts to overlap a little bit.
So I'm just going to talk from the heart for a minute. My gut says we need to mask because that's what our medical community says. And I appreciate that they took the time to email and express. I'm frustrated that our vaccination rate is 39.9%. In Shawnee Mission last night, they decided to mask elementary because they don't have the option of vaccinating. They decided not to mask middle and high school. If that's the case, are they encouraging vaccination? Would parents or adults get vaccinated because they don't want to deal with the quarantine? And would that help in the long run? I don't know the answer to that. I don't think any of us know the answer. I know everybody up here wants the best thing for our kids, and the best thing for our kids is to be in school. And with the vaccination rate of 39.9, we're in trouble with that. And so, I mean, I want to throw that out because there are other options, but at the end of the day, there's no sure thing. We all want it, but it's not out there. And we've got to do what's best for the kids and have that discussion, what's best for the kids. But I also really feel like if we say wear masks, then people don't get vaccinated.
Scott?
I think that's one of the things we have to consider is all of the data. And I think that we have to realize that our schools last year did an awesome job in addressing COVID-19 and the efforts that went into trying to keep our kids and our staff safe. But at some point, adults need to be adults. And I think that what we have in place, or we already decided upon, I would move forward with that. I would ask that we do check temperatures every day. If you've got a temperature, you got to turn around and go home, and then you should get tested. But I think that the masks should be optional as what's listed here. And if you want to take the chance on catching it, that's up to you. But if you've been vaccinated, I don't think that the objective is to get vaccinated so that you don't have to wear a mask all the time. If you still want to wear one, that's purely up to you. And I think that we should move forward with that, because no matter what we do, what we found last year was that the school was not really an area for it where it spread it. It was at home. And so if you can't fix the home, that's where the problem is. So if we were able to be successful last year, I think that we should continue on with what we've got. We've got our teachers vaccinated. We're suggesting that our kids get vaccinated. And I think that the parents need to stand up and be parents. And if you want to accept the results of not being vaccinated, then that's on you and your child. We can't control that. But for our staff, we need to do what's best for our staff to ensure that we can educate the kids that are in our realm of supervision during those hours of the day. So I think that our staff has done an awesome job. I think they've done a great job of getting prepared going into this school year. And I think we should move forward with that, making the masks optional. Because the best thing for everybody is to get vaccinated. It's better to have a bad cold than to end up in the hospital. So I would just say that I think that we need to check temperatures as well as an added precaution if we go with masking as optional.
So Scott, I want to ask you a question in that. Last year, all the data we looked at, people wore masks the entire year. And I guess there isn't data for me to prove this, but I think part of the reason there wasn't spread in the schools is because students and staff were wearing masks the entire year. And certainly, I'm no medical doctor, but when the CDC, who's the people we're supposed to trust in this, are telling me that masks are required to keep the prevention down, if we make it optional, then I think we're shooting the data we got last year in the foot. What do you think about that? And I'm not trying to be cantankerous.
No, that's fine,
I just want to have a good discussion about it.
Last year, you didn't have 39% of the people vaccinated. That's the whole point. And I think Dana's correct. If we say, well, everybody mask up, then, well, if everybody's got to mask up again, then I don't have to go get a shot. It can still spread, whether you're masked or not masked. The thing is, the vaccination keeps you from going to the hospital. It keeps you from dying. That's what it's intended to do. It's not 100%, but it is 100% on making sure that you don't become deathly sick. That's the objective. And as long as we can do that, it's no different than people actually catching the common cold. You should stay home when you have the cold. What do? You still go to work. I got to make that dollar. Well, what the vaccination does is it allows you to not get deathly sick. And so what we need to do is understand that and go out and truly encourage everybody, please get vaccinated. Because ultimately, if it gets to that point, I'm sure the governor or whomever will say, everybody's going to quarantine, everybody's going to lock down, you're going to go through this. So we need to get vaccinated.
I think the other thing is to remember that we have a COVID-19 Delta variant. And so like last year, we had the COVID. This year, we have a variant added to it. And let me tell you, I'd rather mask everybody and delete it in 2 weeks, because hallelujah, it's gone, than have that we have an elective that, well, you can wear it or you don't have to wear it, and then have a huge outbreak. So my vote would be mask everybody, and then if we can delete it later, that's fine. Thank you.
Ann, I believe you wanted to make a comment.
As you said, that the vaccine is not 100%, and I have friends in the healthcare who work at the hospital here. They've been vaccinated, they had COVID, and then they got it again after they got vaccinated. Of course, they aren't deathly ill, but I think that if we leave masks as optional, I don't think it will discourage vaccinations. I think it will encourage failure to wear a mask for anybody. There are enough people in town who are angry about masks that there are a lot of students who have those parents, and they are going to be angry about masking too. And if they aren't required to wear a mask, they won't wear a mask, and they won't be vaccinated either. If we have everybody wearing masks, then there's a general assumption at school that you'll be wearing a mask, and that nobody gets singled out for wearing a mask. Nobody gets singled out for not wearing a mask. It's just what you do at school. And I think that will be more likely to keep us healthy, as well as going along with the CDC guidelines and the American Academy of Pediatricians, and with our local health department and with our local healthcare providers, who are all now telling us that everybody should mask. Thank you.
I might make a comment just real quick, I guess. Scott, definitely agree with you. I would love to see everyone wearing a mask at the school because that's their choice. Because they know that it may affect their family or things like that. I feel like they have to have that choice and make that option. And I guess there's a piece of me that'd like them to give them the opportunity to make that choice. And then if it gets out of hand, then obviously we step in at that point, and there's some scariness in that too, but that is our world. I know that there have been some other districts who've dealt with this, and they've made decisions based on who has opportunity to make choice, who doesn't. Maybe separating grade schools, things like that. I don't know if that's something we consider as a board at some point as well.
I think there's a difference though between the student who decides not to wear a mask and their choice, or that parent's choice for that student, and the decision that they are in turn making for the other students in the classroom. If we can't guarantee situations where staff and students won't have to interact in that 3 feet bubble with unmasked students, we are creating scenarios where bullying or judgment will occur, and we're creating scenarios where someone else is making a decision for whether that staff person's able to come to work tomorrow and whether that student is able to be in the classroom tomorrow in front of a teacher, learning directly with them. And I think that's my biggest issue with the whole thing, is I'm tired of wearing a mask just like everybody else. I'm ready to be done with it, but I also understand, let's get people vaccinated, and 39% is pitiful for our community. If that could improve, I would think, based on medical guidance we saw over the summer, and as cases trended, we could adapt and change and ease restrictions in our schools. But until that happens, I don't want to let someone's personal choice, or under the banner of personal choice, decide whether other students in that classroom get to come to school or not the next day. And so again, based on Saline County Health Department's guidance on distancing, masking, and quarantines, if our stated goal is keeping as many students in a classroom with a teacher day to day, it's a no-brainer for me that we should be requiring masks of all of our staff and students. At the same time saying, go get a vaccine and let's get our vaccination in our community up, vaccination rate in our community up, so that we get to a point where we don't have to do that.
Thank you, Gabe. Ann?
Yes, I have had communication with constituents saying that government should not be mandating things. And I have to say that we mandate stopping at stop signs and stoplights. We mandate certain vaccinations for going to school. We mandate inspection of milk so it's not sour on the shelf and people don't get sick from it. And we mandate seatbelts so that people don't die in accidents. And I believe that this is in line with that vaccinations and masks prevent people from dying and getting sick, and that makes it worthwhile to require those masks. And no one's requiring the vaccine, but I believe that everyone should feel pressure to get that vaccine because it's so effective against the virus. There's disinformation out there that says these vaccines are dangerous, and that is not true. And so it's very important that as many people as possible get vaccinated. And the rest of us wear masks. Well, all of us wear masks. Thank you.
Dr. Bendre?
It seems to me that our obligation here is to make sure that students can be in school, and as Exline pointed out earlier about the period where these folks and other administrators were having to sub in the classroom, we already know we're low on teachers. We already know we're low on paras. I hope that the retention initiative we passed last time helps with those things. But if teachers and faculty start getting sick as well, and too many kids are out because of the quarantine requirements, we can't have school. And that's what I keep coming back to. What can we do to maximize face-to-face learning? What can we do to maximize people truly being in school instead of the 3 quarantines in a row that Scott's granddaughter had to face? I'm not sure she was in that group. I apologize if I'm wrong, but that scenario is what I'm talking about. And again, going back to the medical experts nationally and in our community, and for me, how do we keep the schools open and people there? Masking seems to be the best guidance, is what I'm thinking.
And that's a very good point. You know, my granddaughter was quarantined several times, and she still had a mask on. Okay, so from that standpoint, you can mask everybody up. The only difference is you've changed the guidelines that says if you're masked, you don't have to quarantine. And from that perspective, would my granddaughter still be masking going to school? Well, I would suggest that to my daughter, yes, still put a mask on, okay? Because I don't want her missing as much school as she did previously. But if she could get vaccinated, then she would get vaccinated, because that just, as an adult, that's the responsible thing to do. And so we at some point have to say, and you are correct, we do have rules that say you can't do this, you can't do that. And if we're going to say you have to be maxed up, then why not say you have to be vaccinated? Okay, I mean, you have shots for kids. You can't go to school until you've had your shots. That's in there. I mean, it's that critical. It's a life or death situation. The issue is the younger you are, it's not as drastic. So my concern is not that I'm not thinking about the young kids, I am, but I'm more concerned about the adults in there, and I'm hoping that the teachers would put a mask on. That's just the way that is.
So the way I'm thinking through it, again, in the scenario of just one individual who's not wearing a mask and somebody in the classroom comes down positive, in last year's guidance, everybody quarantined, which is what your granddaughter's situation was. This year's guidance from the experts is different in that if you're wearing the mask and you're outside of the 3 feet, then you don't have to quarantine at that point. So what I'm thinking is having people wearing masks. And again, I hate it as much as anybody else. I'm tired of the things as well, without a doubt. But if that enables us to keep people in school that wouldn't otherwise. So there's two scenarios here. You're wearing the mask and you're exposed, you're outside 3 feet, you're okay. You're not wearing the mask, you're going home. And that it limits the parents, there's a whole lot of parents that don't have any other options for daycare, so that means they're not going to work either because they're staying home, or God forbid, we've got kids staying home by themselves. I hope that doesn't happen, but it puts parents in a really tough situation there. Do I go and get income or do I not? And I'm not sure that piece is in our control as a school board, but boy, the dominoes start falling sequentially pretty quickly there too.
But Doc, is the same thing goes, if they're concerned about their pay, put a mask on your kid. That's real simple.
Yeah.
Dana?
And just to be very clear about this, I have a son who's working on a COVID unit in medical school right now. This is a very real illness, and young children do get very sick. He is seeing them, so that there's no discussion about whether this is real or not. This is real. They're being treated, and they can get very sick. To talk about what you said, Gabe, where, if we want people to get vaccinated, and we do, you and I do, or I'm not going to speak for everybody, but you and I do, what point are we okay with the vaccination record that we could pull mask off? Like, does that have to be set before you would know what the plan was? Would you say 60%? Would you say that kind of, I mean, that, to me, people have to have a reason to be vaccinated, to go, well, when we hit this, we can talk about this.
Yeah, and I don't know that. I mean, I think that would, like I've chosen to follow all along medical guidance from medical professionals. I think that would come from recommendations from community health organizations, the hospital, Smoky Hill Family Practice, whatever those medical professionals are that can give guidance on that. I think my instinct would be to follow their suggestions on that. And so if based on that gating criteria in our green, orange, yellow, red situation, if they feel like we get to a point where, based on the vaccination rate, based on what we're seeing in the community, saying people don't need to have masks in school would not be of detriment to keeping kids in school, I think that's a fantastic point for our community to get to. I don't think we're at that point today. And I think, Scott, you said let that family make the decision and put a mask on their kid. That's not a saving point, because masking scenario 2 that's up on, I think Superintendent slide has it on the screen still, the positive student was not masked, but the other 3 were masked. All 4 students are still going home. We can't guarantee that in our classrooms, masked and unmasked students won't have to interact, masked and unmasked staff won't have to interact. And so by saying it's okay for someone not to wear a mask in the classroom, we are in turn, and that unmasked family is in turn making the choice for the masked family that that personal choice is of greater importance than the student making a choice to be in school every day, or the staff member being able to come to work and teach their students every day. And again, that's the biggest rub for me in this whole thing, is I'm all about letting someone make the choice for themselves, but their choice is hindering someone else's choice in that whole endeavor.
Mr. President, I don't mean to put Shanna and Jeff on the spot, but they both have building level experience and have been in the classroom, near the classroom. Is my assessment of the ability for us to keep students that are masked and unmasked apart, is that on target?
Well, because when you're in a classroom, you have to focus on the educational needs of the students. And so if the educational needs of the students, like you talked about working in a small group, if the educational needs of those students is that the unmasked student and the masked student need to work together with that instructional specialist or that interventionist or that teacher, then you're going to want to meet the needs of those students, masked or unmasked. And so I do believe that there will be times when you're going to have students that are going to be working 3 to 6 feet apart because that's what they need for their educational environment. So I think you were correct in your statements about that is going to be hard for teachers to be able to do on a daily basis.
And I'd just add that there's a lot of undesirable social scenarios there that would play out that would be, I just don't think you want to go there. All the masked kids over here working in this group, all the unmasked, I don't think anybody wants that kind of stuff.
Okay, thank you. As we continue to talk about that point, I thought I probably need a check on my initial assessment of that, so thank you.
I think when we led into this, Superintendent Exline basically said she'd need a decision from us. So if there is a motion, I'd entertain any motions.
Mr. President, I move that we recommend, well, let me see, I'm not sure how to say it. I move that the USD 305 require masking for all individuals, including staff, students, and volunteers, regardless of vaccinations during the 2021-2022 school year. This includes inside any facilities within USD 305.
Emma Doherty, second.
We have a motion and a second. All in favor, please
Can
raise your.
can we make a discussion or?
One additional discussion.
Can we add, would you be agreeable to add language to your motion to state based on community factors and recommendations from medical professionals right now, and should those change, and masking not be recommended or required or necessary based on community factors, school district's able to respond accordingly?
I could follow that, just to say this would be adjustable as local conditions change. Can you second that
I would second
amendment?
Yes.
Thank you. Is that good enough?
Just say it again.
Okay, so we've got a motion, a modified motion, and a second. Would it be possible to maybe read the modified motion? I'm sorry.
I could probably restate it.
I would refer to what she had said, and then she said that based on the community factors and medical professionals, that we could look at it again. So her original motion was to include masking for all students and staff masking regardless of vaccination status inside all USD 305 facilities during the 21-22 school year, but could revisit upon time of medical advice, local change in gating, or in the
Local conditions.
local conditions, yes.
Any other discussion? I might just throw in there, second meeting as president. This doesn't have to be an emotion or anything. I really appreciate the fact that we're able to have conversation and be respectful of each other. With that being said, all in favor, please raise your right hand. All opposed, same sign. Motion carries 5-2. We would now move to our next item, which is adjournment.
Move we adjourn, please.
Motion and a second. Everyone in favor, raise your right hand. Opposed? Any opposed, same sign. Motion carries. Okay,
I'm just raising my hand.
thank you.
And you all had a choice whether to wear a mask or not today. Look at 3 4 here without masks. And you're not 3 foot or 6 foot apart. But you're asking the kids to do that. You each have a choice to wear a mask today, and you chose not to. Vaccinated or not? Do we ask you, are you vaccinated? Does it make a difference if you're vaccinated?
March.